Okay. What you're going to see here that I wrote, and I have this help. I write this out. The reason I'm writing this out is I want you to do this with clients. I want you to help them own it for their own selves. Okay. There's a lot of psychoeducational tools that I'm going to link here, and you've seen already. I've listed Sandra Paulson and Janina Fisher, and there's a lot of books out there. And I also feel like there's something very relatable when we do work with our clients and we help them see it. So here are some of the ways that our bodies and our minds learn to protect ourselves. Here is fight. Fight is kind of like when you go into fight mode, right? When people present with like a lot of anger, they seem very judgmental or mistrustful. I wonder if you've ever had this. I've had clients or even people I've met where like they meet me and they're almost like trying to read through my body language to try to see like how they could almost like make sure that they don't have to, be in this fight mode, right? Or they are in fight mode without realizing. Sometimes they are controlling and destructive, and sometimes you almost see like a suicidal aspect to them, right? Like fight, I want to fight life. I might want to fight myself, right? When I turn inward. But there's this like fight and this hypervigilance and almost like this need to control, okay? And feeling very judgmental and mistrustful. That's what you're going to see here with a fight, okay? Now, flight is kind of escape. I need to escape. I need to run away, okay? What you're going to see here, and you'll see this in relationships too, not just with trauma, right? People talk about avoidant relationships or avoidant personalities. You're going to see the runner here, right? You're going to see the person who's ambivalent in relationships, the person who can't commit, the person who might be addictive. So an addiction is a form of flight, like running away from feelings, running away from hard conversations, right? They might have disordered eating because they're trying to numb. So there's some kind of disconnection and they're escaping. They're ambivalent. They're always on the run, okay? They're always distancing themselves. Now, freeze is really helpful to also understand. Freeze is when somebody's stuck in fear. What you're going to see here is people who are having like panic attacks. They have lots of emotions, but they're frozen, right? The whole concept of panic attacks, and maybe I'll do a training on panic attacks separately, but panic attacks, essentially, we spoke about this, is like inward, like emotions turned inward, right? Usually anger or like this intensity of rage or any kind of emotion or even sadness or aloneness or whatever it is that's coming up. Freeze is that there's emotions that are frozen and they're stuck inside. So then there's this panic. There's this feeling of freeze and I can't escape. I can't run away. I can't do anything with the energy and it's getting frozen inside. You'll see the people here are usually terrified. They're wary. They're afraid of being seen. Sometimes you'll see people in a situation or in a workplace environment, they're terrified of being seen. They go into freeze or in social environments. And you'll see that they are really just like stuck in this fear. Okay, so freeze. Then what you'll see is submit. Submit, you'll often see that they're stuck in shame. And we're talking about shame in a little bit, but submit is very important to look at, okay? Because what you're going to see here is someone who's filled with depression, very ashamed. They're filled with a lot of self-hate. Sometimes it's like towards themselves, but sometimes there's hate that they're holding about situations and things that happened to them that they kind of became a place that it all landed on them. Sometimes you'll see passivity. You'll see sometimes like the good girl or the good boy who kind of was shamed and is holding all of that inside. The caretaker, the self-sacrificer, right? Submit is kind of like, there's the shame. I have to do everything for everyone, right? I gave of everything to everyone and I feel like I have to be the good one right here. So that's kind of like submit and shame. And now the last one is attach, which I think is so important to look at, right? The word attach. Attach is usually a cry for help. What we'll see sometimes when it comes to either adult relationships or even childhood relationships is that the person is looking for connection. They're terrified of abandonment. You'll see, I'll work with clients who are in relationships that we all know are toxic or unhealthy or don't fulfill their emotional needs, right? They might be in a relationship with someone who's in flight, who's avoidant and running and ambivalent, but they run for help. Or someone who's abusive, right? Or even like running towards a parent who has certain, let's say, tendencies that are unhealthy or unhelpful. But they're so terrified, they're stuck with a part that's so terrified of abandonment and rejection that they run towards the person, right? Often it's an innocent part and they want someone to depend on, right? It's like, I need you to depend on, I just need a person. Now you want to get curious about what's going on here. A lot of times it's a part that's stuck in trauma or is a younger part or is like, or the person has a hard time seeing that they can make good choices and they kind of run towards someone or something. Here you'll sometimes see people like attaching or connecting with the perpetrator if there was an abuser or really connecting or or like going towards someone who's not good for them, but some part of them feels more safe attaching than disconnecting. And I just want to help you understand all of this because when we have clients, when they engage in like, right, the fight, which you'll see kind of like is more like angry and control, right? You'll see a lot of anger and control, okay, or needs to control. The flight, that's ambivalent, the runner, right? Sometimes eating disordered, addictive. The freeze, where you'll see kind of like the fear, frozen, weary, right? Panic attacky, okay? Afraid of being seen. The submit, where you see shame, the good girl, the good boy, right? The caretaker, self-sacrificing, often filled with a lot of anger, self-anger. And the attach is seeking for connection, terrified of abandonment and rejection, right? And want someone to depend on. When we see these things, I just want you to normalize it for your clients and even for your own self, right? But this is normal. These are the ways that our minds and bodies learn to deal in situations. Now, there's actually healthy parts to all of this, by the way, okay? If there is someone who walks into my house without permission, you're going to see a fight part to me who's like, I'm mistrustful, and I am going to want to feel like I want to take control because get out of my house, right? Flight is, I might see that there is some kind of situation where somebody asks me, hey, do you want to sign up for a phone plan? This is amazing, blah, blah, blah. And I have a part of me that's like, and I'll be like, oh yeah, maybe, right? And non-committal because I want to be engaged in like a flighty part of myself, right? It depends on the situation. Not if